In April of 2023, I showed you what our last 10,000 clients had selected for their Medicare plans. Since that date, a little over a year ago now, we have added 24,183 new clients. In this video, I'm going to share with you what plans they selected, what was the most popular plan, and why it was so. So as you can see, of the 24,183 clients that we wrote, brand new Medicare plans, you'll see that a little over 2,000 of them, which represents about 8% of everyone we served, bought one particular kind of plan. 5,000, a little over that, 21% of our clientele, and then 71% bought a different plan. And so I'm going to look at the details of these plans. So let's start with here with those that 8% of our population actually bought an in plan. Now, when someone buys an in plan, that's actually a supplemental plan in. So let me show you how that's going to work. With any kind of a supplemental plan, what that means is you're actually enrolling into original Medicare A and B. A is called hospital, and B is called medical. And really the best way to look at this is that really A is pretty much everything that's going to be inpatient type related, and everything on the B side is going to be pretty much outpatient related, as well as doctor services. Now, Medicare is not going to pay anything 100% other than preventive services. So beyond preventive, you're always going to have some type of a financial responsibility in the original traditional Medicare system. We call those gaps, or what simply means financial liabilities you're responsible for. And you'll notice there's 3 gaps on the A, and there's 3 gaps in that B system. So if someone didn't have a supplemental plan, they'd be responsible for all of these gaps. Let me quickly review. So the first gap is what we call the Part A deductible. This year, as you can see, it's $1,632. And that's all we'd be out of pocket, notice, up to a 60-day stay in the hospital. So whether I'm in 1 day, 2 days, 10 days, 50 or 60, doesn't matter. My cost is $1,632. Now, what you got to know about this deductible is it's not annual. It could happen multiple times because that deductible is called a benefit period. So again, it could happen multiple times throughout the year. The second gap, we call this extended hospital stay. So if someone's in the hospital longer than 60 continuous days, that brings us into 61 to 90 days, which is month 3. We have a $408 a day copay, and then month 4 and month 5, if I'm still in the hospital, that's a real long time, I have an $816 a day copay. Here's the point. Month 3 would cost you about $12,000. Month 4 and month 5 is going to cost you about $25,000. These are extended stays. That's our second gap. They're pretty rare, but you'll notice when they happen, it is expensive. The last gap on the A side of Medicare is actually for skilled nursing facility. And this is nothing more than inpatient rehab. And so what Medicare says that as long as we've had a 3-day stay in the hospital or longer, then the doctor can put us in skilled nursing. And notice Medicare covers everything the first 20 days, doesn't cost you a penny. Now, if you're not in the hospital 3 days or longer, they're not going to pay a penny. But as long as we had a 3-day stay prior, Medicare pays everything the first 20 days. But after that, we're still eligible for skilled nursing coverage for another 80 days. But now we're responsible for a $204 a day copay. They say right now the average stay is somewhere between about 35 to 40 days. That means a person is going to be responsible for somewhere between $3,000 to $4,000 of that stay. All right, that's the gaps on the A. There's 3 of them. Now, let's talk about the gaps on the B. Now, the B side, again, everything outpatient, plus also, folks, remember this, all doctor services are paid through Medicare B. Whether you see a doctor in their office or they come to see you in the hospital, it is the B of Medicare that's going to pay the doctors. Everything outpatient related, labs and MRIs, knee replacements, cataract surgery, durable medical equipment, home health care, all those kind of things are going to be covered through the B of Medicare. And so again, we have 3 gaps. The first one is a B deductible. This year it's $240. Now that deductible is not like this one. Remember, this could happen more than once in a year. This happens only 1 calendar year, and then that number resets every January. And after we've met that small deductible, again, once a year, then Medicare is going to be an 80-20 plan. Medicare is going to pay 80 as long as you see a Medicare provider and you're getting a service that Medicare covers. They pay 80, but you're responsible for 20%. We call that co-insurance. So again, nothing's 100% by Medicare, so everything here, you're responsible for 20%. The last gap on the B side is called excess. Now, a couple things about excess. The only people that can charge excess would be physicians. No one else can do it. Okay, Durable medical equipment providers cannot. Ambulatory surgical centers cannot. Only doctors can do this. Primary care docs, specialists, surgeons can add the 15% to the bill. And the whole point is that when they add the 15% to the bill, this is a doctor who takes Medicare but does not agree to take Medicare reimbursement rates. We call that fee for service. They do not agree to take that as payment in full. They're going to add 15% to the bill. Now, this doesn't happen often at all. Less than 5% of doctors today actually charge excess. So again, it doesn't happen. It's rare, but when it does happen, you're responsible for it. Medicare allows it, doesn't pay any of it. So the point is, those are the 3 gaps on the B side. So we have 6 total gaps in Medicare. So when someone decides to get a plan in, here's what's happening. That plan in is going to pay that gap, all of that gap. It's going to pay the full 20%. So 4 of the 6 gaps are going to be covered by that in plan. So the gaps you'd be responsible for financially would be once a year, you would have to meet that B deductible. Again, very low, very reasonable, resets every January. And then if and when you ever went to a doctor or had a doctor that took care of you in the hospital or whatever, and they charge that extra 15%, you would be responsible for that. So in pays for the 6, but you're responsible for those 2 of the 6 gaps. Now, you're also responsible for every time you see a doctor, you could be subject to a $20 copay. Okay, $20 copay anytime you see a physician, and you're subject to a $50 copay if you ever went to an emergency room and you didn't get admitted to the hospital. So we have a couple copays with the plan in as well. And again, what happened? 8% of our Medicare clients actually selected this for their coverage. All right, that brings us then to our second most popular plan. And again, what happened? 21% of our clients selected this particular plan, and this plan is actually called a Medicare Advantage Plan. Sometimes people call these C plans or replacement plans. So this is a different way in which people choose to get their coverage. And again, 21% of our folks said this was the best for them. So the question is, how do Medicare Advantage plans work? So let's go through a couple of details about them. Number one, when you enroll into an Advantage plan, what's happening is this. You actually are getting a private health insurance company is replacing Medicare A and B. You're still enrolled in Medicare A and B, but you're not under the direction, the oversight, the management of that original Medicare system. You now have a private health insurance company that's directing and overseeing and providing managed care for you. Number two, what happens, the insurance company will create a network of providers. This is the way that Advantage plans work. They wouldn't work if that insurance company could not put together a network of providers. This would be primary care doctors and specialists and hospitals and different people that you actually will see because they're under a contract with that insurance company to actually take care of you. Number three, you'll see that the Medicare A and B system that I just went through, those different gaps and how that system works, that is actually going to go away. You're not covered by that system anymore because now with the Advantage plan, it's being replaced by a pay-as-you-go system. Most Advantage plans either have a 0 premium or a very low monthly premium for those plans. And so again, low, no monthly premiums, but instead of paying a premium, what you're doing is you're going to pay as you go. For instance, if you go to the hospital, normally about average right now, it's about $350 a day copay. Now these copays usually stop maybe after a 5-day stay or a 6 or 7 day stay, but they're going to stop somewhere between 5 to 7 days. So if you're in the hospital 20 days, you're not going to have to pay every day. You'll pay a daily copay up to the limit. And that daily copay actually covers everything that happens that day. Every doctor that you would see, if you had a surgery, any kind of test, MRIs, CAT scans, all that is covered. Every service you get that day is covered by the daily copay, and the Advantage plan is responsible for the rest. In addition to that, a specialist. If you go to a specialist right now, this is normally about $50 copay. Your primary care doc is usually very low, somewhere between $0 to $10. But a specialist, this would be a dermatologist or an OBGYN doc or maybe a cardiologist. You would actually pay a $50 copay to see them. Now your scans, this would be your MRIs and your CAT scans, your PET scans. Those are in the average of about $250 per scan. All right. In addition to that, outpatient surgery, this would be for a knee replacement, cataract surgery, those kinds of things. Right now, they're running at about $400 copay for that outpatient surgery. So that covers your part of the bill, which would be the surgeon, the anesthesiologist, the nursing services, the actually facility fee. All that's probably $10,000, $15,000, and you just pay a very reasonable outpatient surgery copay. Durable medical equipment. This would be CPAP machines and oxygen equipment and diabetic supplies and those types of things. Scooters and wheelchairs and walkers, you're responsible for about a 20% co-insurance out of pocket. And then skilled nursing facility, normally, again, about $204 a day out of your pocket. All right, so what I'm trying to teach you is that it's a pay-as-you-go system. We usually don't have to pay much of a premium to the insurance company because we're just simply taking on the risk of those copays. Now, what's going to happen, these copays will eventually stop because Medicare says these companies must include an annual max out of pocket, meaning you keep paying copay till you hit the max. And those are going to vary depending upon the network that you go to. But HMOs right now are going to be in the neighborhood of about $3,000 to $5,000. What's going to happen with these HMOs, you'll pay up to that range, $3,000 to $5,000. And so if it's a $50,000 bill, you're not going to pay that. You'll just stop once you've met that max that's established by the plan. PPOs, what they have, a little bit higher, about $5,000 to about $10,000 max out of pocket, because on the PPOs, you have the right to go out of network. On the HMOs, you do not. And so it has a little bit of a higher max out of pocket. But again, you're not going to pay $50,000. You're going to actually be somewhere between $5,000 to $10,000 out of pocket. All right, so that's the way Part C plans work. Hey, if you found this video helpful and if you want to see more Medicare information just like it, then go below, right below the video, and you can give us a thumbs up as well as subscribe to our channel. And every time I put a new video, which is about 2 every week, you'll be notified of that video, and others just like you who need this vital information will get it as well. And again, that's what 21% of our clients said would be best for them. Now, the third plan we're going to look at today is actually a G plan. And again, what did we say earlier? 71% of the clients at MedicareSchool.com said that's the best coverage for them. Let's look at the details of that Plan G. Again, a Plan G is actually a supplemental plan, so someone's actually enrolled into what? Medicare A and B. And as we know, Medicare doesn't pay anything 100% other than preventive services. So again, we have these gaps that I reviewed with you whenever we talked about the N plan. So when we get a G plan, what it does, it actually covers 5 of the Medicare, 6 of the Medicare gaps, 5 of 6. Remember, N covered 4 of 6, plus you had some copays. Here what we have is we have coverage on 5 of 6 gaps. So what the G plan will do, it'll pay your A deductible, however many times that happens throughout the year. It'll pay all your extended hospital copays. It'll pay everything in the skilled nursing facility, so we actually have full coverage on the inpatient side of Medicare, right? Now over here on the outpatient side, it's going to cover 2 of the 3 gaps here. It'll cover your full 20%. It covers excess charge when and if that were ever to happen. But what it will not cover would be that Medicare B deductible. Remember we said that's an annual deductible, calendar year deductible that resets every January. So this is almost a full coverage plan. But once a year, whatever the B deductible is, you would have to meet that. And then with that, there's nothing else out of pocket. There's no copays like the N plan had. We are totally done once we have met that B deductible. So the first $240 of claims for the year is going to come as a bill in your mailbox. Then after that, again, we're going to have that full coverage. So again, this is what 71% of our folks decided that would be best for them. All right, so to kind of summarize these different plan options, you've noticed then that 21% of our Medicare enrollees actually got a Medicare Advantage plan. Now, I want you to understand there's actually 2 ways in which we can write Medicare Advantage plans. We can write them, and we actually call them MAPDs, and that means that Medicare Advantage portion, which is covering inpatient and outpatient, and then we add a Part D plan, a prescription drug plan, to that coverage. Another way we can write them is called MA only, which means it's a Medicare Advantage plan that does not include a prescription drug plan. And the only people that even should consider this would be anyone that can qualify for VA benefits and they get their meds through the VA system, or they're retired military and they actually have what's called TRICARE insurance, and then they actually can get their medications filled through their TRICARE policy. All right, they can do very well by doing an MA only plan. So if you're not VA or TRICARE, you wouldn't want to do this. You could get an MAPD plan. All right, now 79% of our clients actually got what? They got supplemental plans. Now I want to clarify something for you. Supplemental plans are also called Medigap policies, filling in the gaps because Medicare doesn't cover anything 100% other than preventive. We know that now. And so they're filling in those gaps. And again, we said that 8% of our clients got an N plan, covered 4 of the 6 gaps, plus you got a few copays. And then we had 71% of our clients actually got a G plan, which covered 5 of the Medicare 6 gaps. All right, so now let's take a look and let's answer this particular question, because I get this all the time. why more supplemental plans versus Advantage plans? So why do more of our clients select them? And folks, the word is this, really one word, and that is because we educate them. In other words, they have an education about the differences of these systems, and 79% say, hey, we have chosen a supplemental plan for that reason. And so let's look at a chart here, and let me show you some of the difference between SUPs and Advantage plans. Now, they do have one thing in common, and that is this. Notice you must be enrolled in Medicare A and B. A, for most people, Part A is a zero premium, but B actually costs something on a monthly basis. Most people this year are paying $174.70 a month for their Part B. If you're considered high income, you actually could pay more. But my whole point is whether I have an Advantage plan or I have a supplemental plan, I am paying my Part B premium. And then beyond that, these two systems are totally different. Let's look at the differences. Number one, if you have a supplemental plan, notice you can go to any Medicare provider. As long as that doctor, that hospital, that specialist agrees to take Medicare A and B, they will take your supplemental plan of choice. Not so when it comes to an Advantage plan. We have networks, HMOs and PPOs. There will be doctors that will take both. There will be doctors that will take one or the other. There's doctors that will take none of these. Okay? They just simply do not want to participate in the Advantage system. And so when you're on an Advantage plan, you're always going to be in some type of a network. HMO, one of the issues is sometimes you have to have a referral to see a specialist. Also, HMOs, you can't go out of your network unless it's an emergency. You're bound to that network, which is going to be limited, as well as some restrictions. PPO allows you to go out of the network, but as you saw earlier, it costs about twice as much to do that. And again, these are network plans. Right here, we have no networks whatsoever as long as the provider takes Medicare. You need to understand, it's a big difference. Number two, also when we get a supplemental plan, we actually add a standalone drug plan that you pick out based upon the meds you take and the pharmacy you want to go to. You selected that formulary, and it's a separate plan. When it comes to Advantage plan, notice they integrate it. They actually include that. So the insurance company is picking the plan. And frankly, sometimes those are very good plans. Sometimes they're not so good, kind of mediocre. But you have to make sure if you have an Advantage plan, because they picked out the plan, is that drug plan going to be good for your particular prescriptions? Number three. Now, when it comes to supplemental plans, we always pay a premium. Remember, we transferred the liability of those gaps to the insurance company, just like we do for auto policies and homeowners policies. We transfer liability to an insurance company, and they take that liability, but we have to pay them a premium to do that. And we looked at the liability, the gaps, and so clearly we're going to pay some kind of a premium to the insurance company to take that liability from us, to transfer the gaps. But the reason people select these is because of predictability. If I have that G plan, I know what my premium is going to be to the insurance company, and I know once a year I got to meet my Medicare B deductible. If I have the N plan, I know what my premium is going to be to the insurance company. I know I'm responsible for the B deductible, excess charges if and when that occurs, and some co-pays when I get certain healthcare services. All right, so again, predictability is the key here. Over here, remember, we just went through that. It's a pay-as-you-go system. We're not sure what healthcare services we're going to need. Could be few, could be lots. We don't know that. But again, they're going to set some kind of a max out of pocket for the year. Just a different way in which we pay. Okay, number four, supplemental plans are lifetime plans. In fact, they can never be canceled for any reason other than non-payment of premium. So in other words, these are lifetime plans. So if you have a G plan, you have that G plan the rest of your life, pay the premium. They're also portable, which means if you're, let's say, live in Denver, Colorado, and you want to move to Miami, Florida, you can take that supplemental plan with you. The insurance company cannot cancel it on you because you relocated. They can't cancel because of claims. They can't cancel because of age. The only way they can ever cancel it is if you don't pay the premium. All right, so it truly is a lifetime policy. In addition, when it comes to supplemental plans, whether you're in Denver or Miami, Florida, or you're in Hawaii, and you pull out that Medicare A and B card and your supplemental card, the coverage is the same anywhere you go, right? Because there's no networks. Now, when it comes to Advantage plans, they're not lifetime, they're annual. It's an annual agreement between Medicare, the insurance company, and you. And those plans can be changed, and we're going to see a lot of that in 2025. Those plans can be dropped. They can be increased. They can be reduced as far as benefits go because they're annual plans. And they're not really tied to you. They're actually tied to a service area, which is typically a metropolitan area. So if you leave one city and go to another city, you're not going to take your Advantage plan with you. You have to get a different Advantage plan after you make that move. Okay? This is tied to you. This is tied to a service area. Next. So this would be number five. When it comes to supplemental plans, notice they have little to no perks. You're getting just high quality medical insurance to cover those gaps. Over here, we have a variety of perks. These are the plans they're going to offer you: a gym membership, maybe a dental allowance or hearing aids, or maybe an over-the-counter card. So they have different perks that they provide to you. And so when someone's looking for perks and they think that's important to them, then again, that's probably someone leaning more towards an Advantage. If someone's leaning just towards good quality, high medical coverage, then probably leaning towards a supplemental plan. In addition, this is a big deal. You'll notice the word pre-authorization here. Supplemental plans, no pre-authorizations. Advantage plans, required for sure, about 70 to 72% of the time. Pre-authorization means this: the doctor says you need a CAT scan, MRI. Doctor says you need a knee replacement or hip replacement. Doctor says that you need to stay in the skilled nursing for a longer period of time. And so those kind of services have to be pre-approved by the insurance company. Over here, that never happens. So over in this system, the doctor says this is what you need. Medicare says we'll cover it. End of story. Insurance company can never interfere in any way. They're going to pay if Medicare pays, right? Over here, again, now the insurance company has the final say so. Doctor recommends, insurance company must approve. And sometimes they approve immediately, but sometimes they delay the approval. They may say doc says you need a knee replacement. They may say, no, we want you to go to therapy for 9 months. The doctor may say you need a full hip replacement. They say, no, we're going to pay for a rod only. I've had that happen plenty of times. Well, here what's happening is the insurance company has the final say-so, not the doctor. All right? And then next, when it comes to enrolling into a supplemental plan, what happens is when you first go on Medicare A and B, you have a 6-month window where you can get any supplemental plan of your choice. Okay, whatever you qualify for. There's no underwriting. You just simply, if that plan is in your area, your state, if you're born after January 1st, 1955, meaning starting Medicare after January 1, 2020, then you have 8 different options available to you. If you're born before January 1st, 55, starting Medicare before 1/1/2020, you actually have 10 different plan options. So whatever you're eligible for, you can enroll into that plan during the first 6 months of your B date, and there's no underwriting. We call this guaranteed issue. That insurance company has to issue the policy. They have to cover all your pre-existing conditions. You cannot be denied. Now, after that 6-month window, unless you live, of course, in New York, Connecticut, Vermont, Maine, or Massachusetts, now you're going to have to go through underwriting. So that's why this 6-month window, we call this the OEP. It's very important period of time, OEP, because why? No underwriting. Now, regardless of your health conditions, pre-existing issues, doesn't matter. Insurance company will approve the policy. But again, after that 6-month window, except New York, Connecticut, Vermont, Maine, Massachusetts, now you may not be able to get one of those policies. Now, when it comes to Advantage plans, and we talk about enrollment, there's no underwriting whatsoever. The issue with Advantage plans is if I take an Advantage plan, let's say I start at 65 and then I'm on the plan for a year or 2 or 3 or 4 or 5 years, and I would like to switch from here and get back over into this system, A and B with a supplemental plan. And now to make the switch, again, unless you live in those 5 states, you're going to have to go through medical underwriting. This OEP opportunity is now gone for you. And now we're going to have to ask you 30, 40 health questions, check all your medications. That health information is given to the insurance company. And so if you've been on that Advantage plan for a year plus, now they don't have to accept you. They can actually deny the application, and they will if they don't like something in your medical records. If you have rheumatoid arthritis, they're going to decline it. If you have spinal stenosis, it's going to be declined. If you have AFib in your medical records, one incident, you're going to be declined for that. Certain medications you take, they can decline those applications as well. All right? And so again, you just be mindful of the switching rules. So those are the things that we educate our people about, and that's why a full 79% chose supplemental plans and 21% chose Advantage plans. All right, now, let me tell you, folks, frankly, this is about the opposite of most people that do what we do. Most agents, this would be just the opposite. Okay, most agents are going to focus over here on Advantage plans. It'd be more like 80% and maybe 20% supplemental plans. There's actually some agents that have 100% of their clients in Advantage plans. And I'm going to tell you why this happens. And this is the only reason, is because over here, we absolutely get a lower commission. We get a nice commission. We make a nice profit in this business. It's a very wonderful business to be in. But what happens with Advantage plans, much, much higher. It's the highest commission product that there is available. So as we compare these two products here, what happens, this actually pays the agent twice as much commission initially, and it also pays a lifetime residual. when we write one of these plans, we get paid an upfront commission and 6 years of residual, and that's it. In this business, this is very much a volume business. We don't make a lot of money off anyone, so it has to be volume. But when it comes to these kind of plans, we can truly get lifetime residuals and a double on the initial commission. So that's why a lot of agents push these. It's not because they're trying to make sure you have the best coverage. They're making sure that they get the highest commission. Hey, if you've come to the place where you know you're going to have to make some Medicare decision pretty soon and you want to make the right one of the best ways to do this is to go down below, and you'll see in the comment section there, the very first pinned comment at the top. You can actually click on the link there and you will book a call. And you'll book a call with one of our Medicare guides. All the guides with our company, I have personally trained them. They're professional, they answer all your questions, and they'll show you your Medicare options so that you'll be confident in your decisions. Let's get back to the video. All right, we're going to wrap this up very quickly, but I have to pose really two very important questions to you, and that's this. Why more Plan Gs written by our company versus Plan N? Why is that? Well, here's why. Because what a lot of people want is they want the most comprehensive coverage available. And that's what they ask us. What is the plan that's going to give you the most comprehensive coverage? Now, in the old days, and if you were starting Medicare before 1/1/2020, you actually would have got an F plan. But today, the most comprehensive coverage is absolutely the G plan. All right, and so a lot of people want that. Why? It covered 5 of the 6 gaps, no copays, nothing, pay the premium, and you're done. All right, now there's another reason why people do this, and that is because even though the N plan is less of a premium, on average, usually about maybe $30 or $40, sometimes much more than that in certain states, but on the average, $30 to $40. So what we find is that a lot of our clients, the premium difference doesn't really matter to them, okay? Doesn't matter. In other words, they're just saying, hey, that $30 to $40 is not going to make me break me. I just soon have the most comprehensive coverage. Now, again, there's some states where it's farther than that for sure, a bigger spread than that, but in most states not. And so they're just saying, nah, that just does not bother me. But here's what I want you to realize, folks. When it comes between the G and the G and N plans, both are great, okay? Both are great, and I hope you know that. I don't believe one's better than the other. We are all different people. And so some people just soon have more comprehensive. Other people say, nah, I just soon, if I'm going to save that $30 to $40 a month, that's going to give me $480 in my pocket if I decide to get that in plan, and I'm all about saving money. And then if that's the way you're wired and that's important to you, that's exactly what I would do. Truly, both of these plans are great. All right, I'll close out with this final question just real quickly here, and that's this. Why Advantage plans? Why? Folks, we write them because there's a time when the Advantage plan is a very good option for certain people. Number one reason would be this, the budget. If a person cannot afford an additional premium to pay for their Medicare Supplemental Plan and for their drug plan, meaning their budget is extremely tight, they should not get a supplemental plan at all. They actually should enroll into the very best Advantage plan they can find for their situation, all right? And so budget is a good reason. We encourage people to not try to buy something they cannot afford. Hey, I'd like to drive a Jaguar, but frankly, I cannot afford it, and I'm not gonna get one. And so we wanna live within our means. So if budget is an issue, then you get an Advantage plan. The second reason why Advantage plan is because Advantage plans are better than having A and B only. There's 10% of the population that has A and B only, which means they're responsible for what? All those gaps. They have no drug plan whatsoever. And so when we get an Advantage plan, we got a drug plan included, and we also have a max out of pocket, right? The HMOs were $3,000 to $5,000 a year, at least has a max. If I had A and B only, there's no max. Sky's the limit. It just keeps going and going and going. So that Medicare Advantage is tons better than having A and B only for those reasons. You got a drug plan included and a max out of pocket on an annual basis. Now, the third reason about Advantage plans is this, because most people will find that the max out of pocket, remember I said those reset every January, but the max out of pocket is an annual amount, and they will say this, that annual amount is manageable, meaning it's not going to break me. I can afford that, all right? So they find the max out of pocket, again, the $3,000 to $5,000 on an HMO, $5,000 to $10,000 on a PPO, they can afford that. Now, there's sometimes people can't manage that, and so what we encourage them to do is to get some kind of what we call a copay protection plan or a hospital indemnity plan, because if that max out of pocket, if you don't have that in the bank and you reach that $5,000, what you can do, you can buy for a very small premium an insurance policy to actually cover for your hospital copays, and we'll give you a lump sum if you have some kind of a cancer situation, which is usually what pushes people into that max out of pocket. All right. So is there a place for Advantage plans? Absolutely. And that's why 21% of our clients chose them as the best option for them. Thanks so much for watching.